Okay, hi folks. Welcome to Office Hours with Dr. Ellen Derrick. I'm a double board certified general and vascular surgeon, also board certified in obesity medicine. And our episode today is going to focus on myth busting for lipedema. Perfect. Both diseases can impact the way a patient looks. So, obesity at its base level, it is additional energy that is stored in the adipocyte or in the fat cell. And those fat cells are distributed evenly throughout the body. And the most common fat cell that is enlarged due to the extra calories are white fat cells. It's a disease of white fat cells. When a patient has obesity, and we are learning a lot about this, it's not simply extra calories in and not enough exercise, but once there is enough accumulation of additional storage in the white fat cells, the white fat cells start to act as their own endocrine organ, and they secrete different factors that give metabolic disease. And we see metabolic disease with liver disease, we see metabolic disease with cardiovascular disease, and we see metabolic disease with sometimes some neurologic diseases. Also, very commonly, the pancreas gets involved, and we see diabetes. These are commonly known in medical literature as the metabolic disease of obesity. So, lipedema has some similarities, but is also different. And it's very interesting. And there is a lot of active research going on in both of these worlds. So, lipedema is also disease of the adipocytes or the fat cells, and it is commonly the white fat cell. But what's fascinating in lipedema is that the inflammatory response of the fat cell does not create the metabolic syndrome that the white fat cell does in obesity. It creates local inflammation, and it tends to focus the dysfunction in the lower extremities as well as the arms. And one of the big hypotheses right now in lipedema is that there's something about the cytokines involved with lipedema that may prevent some of the white cells transitioning to beige cells. And it is the transitioning or the browning of the white fat that is a natural balance that patients without lipedema has. And this opens the door for GLP-1. Sure. Okay, so why doesn't diet and exercise cause lipedema fat to go away? Well, the simple answer is because lipedema fat is not, it's not the result of additional calories. The way the thinking is that primary obesity, that's how primary obesity begins. It's really, really interesting. And I have a lot of patients who talk about water submersion and how that's so important to reducing the impact of fluid in the lower extremities. And patients will follow up with me and say, oh my gosh, and I did, 20 laps in the pool. And I always think to myself, well, that was the wrong exercise. That was not the assignment. Lipedema is not about increasing the exercise, it's about doing smart exercise. And the smart exercise can reduce some of the inflammation cytokines, and it can help promote the browning of the white fat. Because a patient that does not have obesity and that does not have lipedema, their white fat, when it is exposed to exercise, that white fat will have some beige fat starts to transform within it. And we like to think of that as browning of the white fat. So how can a patient with lipedema, quote, lose the lipedema fat? And I think that there are probably three ways that they can reduce the lipedema fat. One is the abnormal fat is going to recruit fluid and fibrosis around the fat. And so patients with lipedema, not only do they have enlarged adipocytes, but they're also carrying additional water weight. And any lipedema patient will tell you that if they eat the wrong food that triggers them, boom, 8 pounds, just like tomorrow. And so it's very frustrating for them. One of the things that they can do to reduce the fluid is they can submerge in water, which helps support the fluid return, and they can eliminate the fluid. Another area that can reduce the fluid and the inflammation and the local response to the inflammation is GLP-1 with GIP, and that's tirzepatide. And then the last option that is a terrific option for any patient with lipedema at any time is to have lipedema reduction surgery. And lipedema reduction surgery debulks the fatty area, the abnormal fat. And so patients will have a change in their contour. They will have a change in the local impact of inflammation and fluid trapping. And they will also have reduction in pain that comes with lipedema. Okay, this is great. Liposuction for lipedema is just cosmetic. Okay, guys, hello. No, that is just not even true. Cosmetic liposuction is a terrific surgery for any man or woman that wants to change a small contour in their body. It's terrific. You know, if you're close to the six pack abs, but you don't totally have them, liposuction is great. If you have what women will affectionately call the third boob over here on the side from the bra, oh my God, liposuction is terrific. And I want you to get it. If you need it, you go get that liposuction. Okay, that is not lipedema. If you have lipedema, you have heavy, painful legs and arms that impact your mobility, that make you have tenderness to touch by a family member or a cat. It makes blood pressure measurement a nightmare when you're with your primary care physician. It makes simple things like a massage or a pedicure almost impossible to bear. That is very different from the six pack that you want accentuated with your bikini and the third boob that you don't want anyone to see in your Lululemon sports shirt. Lipedema is abnormal fat. And so the way to treat it is to remove the fat. And the word for that is lipo, because that's the root word for fat, and suction. They are entirely different procedures for different reasons. Okay, so this is a great myth. Is lipedema cellulite? So no, the short answer is no. Patients with lipedema can have cellulite, and patients with cellulite can have lipedema, but they're different. In between your fat cells are small fibrous bands. When a fat cell gets bigger, because, for whatever reason, for myself, I had too many Oreos or donuts, and I had too many calories that day. And so my fat cell is going to enlarge to hold those calories for me, so that on the days when I'm busy in clinic and I don't get to eat, I have energy for my daily living and I can think and do all the things that I want to do. So over time, if my adipocyte grows larger, my fibrous band that is natural between my fat cells can get a little scarred over time. And now you're going to see dimpling in that fatty area. And the dimpling really just says, this area of my body is storing a lot of energy for me for future use. And it can be totally normal. We may not like the way it looks because of the expectations that we put on ourselves for appearance, but it is totally normal and healthy to have cellulite. The difference between cellulite and lipedema is that those fibrous bands become very thickened because of the inflammatory mediators of the adipocyte and the milieu around the abnormal fat cell. And that creates scarring. And over time, it can create almost a compartment syndrome in that little teeny compartment. And so that can impact the nerve and give the nerve pain. And we think that's one of the reasons why folks with lipedema have painful fat, and folks that have cellulite is not painful, but lipedema fat is. And they can look dimpled, but lipedema on physical exam is much firmer, and you will almost feel like rice nodules or grain in there that is different than what plain good old fashioned cellulite looks like. And I have some cellulite, guys. Just memo, we all have a little cellulite, and that's totally okay. Thank you for joining me on Office Hours with Dr. Ellen Derrick. We busted some great lipedema myths today, and we hope you'll join us for our next episode. Take care and have a good day.